Well, it's interesting, when you asked me to do this a few weeks ago, I sort of thought, what does that mean? And then in getting ready for this, I actually thought, I don't really think I know what it means. So, I've heard about the humanities for many years. I've gone to the humanities dinner from Dal,
Right.
and sort of have an idea that it has something to do with the arts and medicine. But actually went and looked up a definition for the humanities and medicine on Wikipedia, of all
Right,
places.
of course.
And
Or Google Scholar.
yes, and there was a fairly brief definition, but how it's about how the humanities, to my understanding, and humanities are things like ethics, philosophy, history, and the arts, so literature, theater, cinema, that kind of thing, how they relate to your medical practice and medical education. So that made it a little bit more clear to me what it was. But until then, like I said, I felt like I had an idea what it was, but really wasn't quite sure, and I think that's because no one ever really made it clear to me during my medical education.
So that's something we can at least begin to explore as a department.
Yeah, I would think so.
Yeah.
I think it would be really useful for our both department faculty and the learners to actually know what it means, and then that might lead to perhaps some more interest.
Yeah, and what maybe it means for us at this time in this particular kind of practice,
Yeah.
right, in psychiatry.
It probably means different things or would mean different things to different people.
It seems to be a pretty broad list when you start to look at the different sort of references.
I think philosophy and history are very important, for all psychiatrists to really have a framework to base their work upon.
And would you say for you that those aspects of history and philosophy engages you particularly?
Yeah, those are the two areas that I'm particularly interested in. So I have a little library of.
How did you get interested in it?
I think I personally understand things best when there's a historical context, and the history of ideas is very important in psychiatry. And of course, I've been a psychiatrist most of my life now, and it's sometimes a bit hard to know when you started to be interested in something. But I certainly was very fortunate to have good teaching and supervision in those areas when I was young.
I had no idea what it really meant. It sounded really cool because you get to work with Dr. Murray, and who
Yeah.
doesn't want to do that?
Yeah.
And in meeting with him, he was so energized by it, and you could really think about anything in the field of art, literature, history, and how it had influenced medicine. And I found that really interesting. And it was also very flexible in your thinking, and you spent most of the year in a curriculum and thinking about things, and it really gave you a chance to expand your mind and think about how did we get to where we are,
Yeah.
and thinking about how, illness have been treated, mental illness have been treated, or not treated, so to speak, socially, and where we were now, and also where it had been in between and where we needed to go. I mean, there was still a lot of room to go, but it was a really interesting historical journey that also made me very interested in that field. And he was a really good, inspiring is the word, yeah. Just teacher, and so interested and knowledgeable, and so socially conscious. And I think that's...
So a mentor in roles of the physician.
Yeah.
Outside of the science.
It made you think about medicine beyond the book, and really thinking about what our role is, even just as advocates, understanding what goes on in the world and in history that's influenced, and how would you work within that to evoke change, but also understand how we got to where we are and how we would move forward.
Everything but the long lists of symptoms and syndromes, and everything but the analysis of lab and imaging, it's almost everything else. So it brings to mind William Osler's overused aphorism about, it's much more important to know what sort of patient has a disease than it is to know what kind of a disease a patient has.
Who your patient is.
Who your patient is.
In a really broad way, maybe.
And thinking back to people who taught me, and showed me how you hone in on the person rather than, necessarily ticking off the boxes for a diagnosis.
personally, I always think movies tend to resonate with me as well. Just because I like movies, I tend to be drawn to movies that either have really interesting, complex characters, or they do a really good job of demonstrating mental illness and the impact on people. And I can think of a great film I saw a couple of years ago. It was a French film that was nominated for an Oscar. It was called Amour, and it was about an elderly couple living in France, and the wife develops dementia, and it's all about how her husband has to look after her. And I mean, it's just tragic, and it made it a little more real to me what my own patients probably experience that we don't see. The arts can be really useful in helping to enrich the experience. So I think what's a gain about some of the curricular changes we made this year, we've actually incorporated more, for example, about formulation into the curriculum for the residents, and are going to be having movie afternoons where they're going to sit for an afternoon, watch a movie with the faculty, and then they're going to practice their formulation skills.
Maybe be more relaxed in a way, maybe be able to learn in a different kind of environment.
It's a safer way.
Complements it.
It complements, right? It's kind of a safe environment where you can hypothesize, theorize, and it's low stakes because it was a character in a film, for example.
Yeah.
I would say art portrayal of medicine and physicians and how people see us in different roles was kind of eye-opening to me, because it didn't feel like we were in training. You don't feel like you're in an authoritative role, or that you're I say paternalizing. But actually how it's experienced is very different when you're in the illness role. And as young physicians, most of us hadn't had the experience of being in an illness role ourselves. So it was just, I think that was a really good perspective taking, so that when you're in the position of giving information and actually thinking about how that feels and how do you actually work with the person that you're talking to, and that they're part of it, and not that you're telling them what you're going to do, what's the next step. So I think that from the perspective of being more human as physicians, I love photography. And
So the images
and images of people and facial expressions and how we portray emotions and beauty and
So some aspect of it.
I'm less of a visual arts or music even, much more the written word. So history of medicine, history of psychiatry fascinates me. And I think drawing on literature for how we are with our patients, and I'm an avid reader, always have been. So the written word, I think, is to me the most powerful. I was in Dublin. I did part of my training was in one of the small hospitals, Sir Patrick Dun's, now long closed. It had been attacked. It had been one of the rebel holdouts in 1916. And I was doing a clinic one afternoon there in a tiny little room with this old desk that had been there for generations, and looked for a pen or something in the top drawer and pulled out this. It was a long accounting-like book where you'd have a ledger almost, but it contained clinical notes from 1928. And so the kinds of and it was pages and pages of these handwritten copperplate, beautiful writing notes, in spite of it being by doctors. And I was just resonating, that I had located this and found, Many aspects of the arts that have informed us and sort of picked out some of the essential pieces of human suffering, and how much more powerful an emblem of suffering than the scream, that famous painting. I've had very powerful written passages. A couple of my patients have donated me their books that they've written about some aspect of their suffering. So I think we draw on the arts to be who we are when we're with people and practicing our profession, and there's an endless supply of that.
I think becoming a psychiatrist seems to take years, but once you've done it, which is something that I was keenly interested to do, it seems relatively simple, but it's not simple until you understand all the things that you need to know to do this job. And so I find the background, particularly Jasper's general psychopathology, really gives people the framework to understand people and to understand, that we are a combination of a physical being, right? I mean, we can't hold our breath forever and stay conscious, right? We need that oxygen going to the brain, right? Like, we're physical, but we also have freedom, and we are not just a set of neurons and a set of cells, more broadly, that operates on a physical level and is completely predetermined. We're not automatons, right? We're free human beings, and so I think that the whole framework, the whole concentration on phenomenology to really understand experiences that people have and put them in some sort of order, and to construct the psychiatric diagnosis, very complex. It still plagues us.
Where the arts are concerned, like literature or movies, they demonstrate how people have a narrative, how there's a story. And I think it's a good reminder that in our own practice, it's really important to get a narrative from a patient or really understand what their story is, so that you can formulate them or really come to a much better understanding of what they're going through. And because you're not with your patient all the time, it's sometimes hard to know, but when it's demonstrated for you in more detail in film or in a book, I think it makes it quite clear how important it is to get a sense of what their story is.
I think the other thing is, in terms of working with youth and going to a lot of the Mental Health Foundation and other activities that are put on within our community, where consumers or people with lived experience might do either art or express themselves in spoken word. And I find that really informing and creative, but also I think it's probably doing more in terms of breaking down stigma and making mental illness real, and helping people who haven't accessed help or haven't thought about whether they're actually suffering, or that having some hope that there might be help out there. I think that's doing more than a lot of the things that we do when we stand up and give presentations.
Yeah.
So it would
Public
really
consumption, yeah.
guide you, because it means you have to know yourself and what your challenges are, but also what your strengths are, and be able to articulate those in the context of what you're doing and who you're serving.
So that's interesting, Mark. So sort of the idea of being attentive in your practice, right,
Yeah.
as one of your missions, and staying sort of fresh and changing it up, staying a little creative.
Yeah, I think you worded it better than
Yeah.
better than I did.
Interesting.
But yeah, definitely I think being creative and staying fresh, because it's really easy once you're in a position to kind of settle into complacency. And for me, the way that I stay interested is to keep things fresh and try and bring in, incorporate new ideas. And sometimes it works, sometimes it doesn't. I think fun is really important, and learning should be fun. Not everybody might agree with me, and I don't even know why I think that. I think mostly because I like to have fun.
Yeah.
I get really bored otherwise, and so in thinking about the humanities as an example, that is a way to make learning fun, to incorporate the arts, whether it's watching a movie, reading a book, discussing it, but it brings in fresh ideas, it's interesting, it's creative. And I think what it does, it works really well in having learning happen in groups. And to me, that's one of the ways that you keep learning fun and work fun, is to actually work in a group and share ideas.
Well, there's always lots of talk about sort of interdisciplinary kind of work in mental health, in particular collaborative practice, and you know, you actually need to practice collaboration, right? Often, I think, right?
You
So
do.
we need those opportunities for
Yeah.
learners as well.
Yeah.
Again, as you say, I like the idea that when stakes are lower, that they're not always being evaluated. Sometimes you need to just experience. You've had a long and vibrant career in mental health work. What do you think has powered you personally to keep having interest and enthusiasm?
I know so many stories. I mean, I have narratives that roll around in my head from as early as the first clinical training rotation I served in. And most of those are inspiring. Some are sad and have ended badly, but a lot of memories of people who I've known in the most intimate kind of way, where they've revealed to me the secrets of their lives, often in deep suffering, and then as time went on, as treatment progressed, seeing change and seeing the person most often return to who they had been before. Respect. Empathy. I think you have to learn empathy, and empathy embodies respect. It embodies kind of interest and concentration and adapting oneself to who you're dealing with. So it's the interaction, it's the human interaction that we have the privilege of engaging in many times in a day, that we've trained ourselves, I think, to use well in the service of our patients. That's, I think, the humanity that we should embody, all of us should embody.